in the final days of Colon Cancer Awareness Month. This month aims to raise awareness about a cancer that is easily preventable through early detection. And joining us now is Karen Medlock, an oncology nurse navigator. How are you doing, Miss Karen?
Doing well, thank you. Thanks for having me.
And thank you, as always, for being here with us. Just tell us a little bit about your job as an oncology navigator nurse.
So like I said, I'm a nurse that works in the cancer center. I work with oncology patients specifically, so just reaching out to those patients early on in their diagnosis and kind of being the person, their point of contact in the office if they have any complications or questions, if they need a social worker, dietitian, other things like that. I'm the person they would reach out to and answer questions and guide them along their cancer journey.
And you're here today to talk about something that is so critical and people really need to know about, and that is colon cancer. Of course, the guidelines have changed because we're finding that more and more people are being diagnosed at an earlier age. What is the age now that people can get can be screened?
Right. Started in 2021 that age for colon cancer screening moved to 45 versus 50 that it's been in the past. We've seen an uptick in the cases that are being diagnosed earlier and in the age group from ages 45 to 55. I think we're leading a more sedentary lifestyle, spending more time behind a computer screen and those things like that, and not getting as much physical activity, and I think that may be one of the reasons we're seeing that uptick.
And so why is it important for, I guess, doctors and for us to be able to have healthier lifestyle, healthier habits?
That's going to help prevent, help with our prevention of cancers. Obviously, if we eat diets that have more fruits and vegetables, higher fiber, and we're eating less of those processed foods, specifically red meats and things like that, that does increase your risk of having colon cancers. So if we can be healthier as far as our diet and as far as our exercise, then that raises our chances of not having cancers.
And of course, when it comes to those who may be a little bit afraid or embarrassed about talking to someone that they may have some symptoms, what do you recommend?
Well, you know, if it's something that they're embarrassed to talk to their personal care provider, I would hope they wouldn't be, but if they are, there are ways that you can start, like with a FIT test or a Cologuard test. These are tests that can be done at home. Now, obviously, the colonoscopy is the gold standard for screening for colon cancer, but there are things that you can do at home that starts the process. Then if one of those comes back with a positive indication, then at that point you would have to get a colonoscopy.
All right then, well, thank you so much there, Miss Karen, for joining us as always to talk about something that is so critical in our community.
Thank you.